Meanwhile, the Salaries and Remuneration Commission has now been summoned by the Senate Standing Committee on Health to discuss the impending doctors' strike. The doctors' unhappiness and the strike by clinical officers and nurses has led to a degeneration of health services. The church has also weighed in on the matter, calling into question the government's commitment to ending the stalemate. Gina Kiruri reports.
It has been a common scene throughout the pandemic in Kenya, doctors threatening to down their tools, which in turn has injected fear in many over where to turn to for medical help. Among the demands by health workers is better pay.
We have said enough is enough. Let the people who have been favored by the government go and serve the patients. Let them work for the risk allowance. Let them take the risk today.
The Senate Standing Committee on Health had requested the Salaries and Remuneration Commission to appear before them to discuss payment and allowances for doctors.
The standard risk allowance is a CBA item which the unions know when and how to negotiate this each time a CBA expires.
But if anything, a letter from SRC in response to the committee revealed the very underpayment doctors have been complaining about. The current risk allowance paid to a doctor working in a public health facility is 20,000 Kenya shillings, while a nurse's is 3,850 shillings, laboratory technologists 3,000 shillings, while mortuary attendants and chemists receive 2,000 shillings to cushion them in times of emergency, loss or hazardous conditions. The Kenya Conference of Catholic Bishops has also given its 2 cents on the matter. They say that demonstrations and protests are disruptive in providing medical care to patients.
The suffering patients go through whenever there is a strike. It should remind us that saving life ought to be a priority for both the government and the medical staff.
The church adds that a strike is not the answer to these issues, nor is the government's failure to honor the doctors' demands.
We regret that the tension between the government and the doctors will not be resolved through arm twisting from both parties. There is need for a constructive dialogue.
In the past months, Kenya's bruised healthcare system has been riddled with claims of lack of PPEs, some of which are still stored in KEMSA warehouses due to the ongoing corruption probe. Gina Kiruri, NTV.